to AETCM, the emergency medicine channel. So we are following our skill drill portion. Hope you watched the last few videos we posted regarding your assessment related things and then medication administration. So we are following the same skill drill portion. So today we are going to focus on the ABG interpretation, basic ABG interpretation. Mostly here I want to focus on the basic acid-base disorder and then mixed acid-base disorder. So we know, like, if you are handling the person inside the hospital, or ED means, so this is one of the most important element or investigation which will comes under your primary survey adjuncts. So you have to you should have some basic idea regarding this. Pre-hospital wise, mostly we won't get this modalities or provision in pre-hospital anyway. That's why I told in hospital it is the most important element in your primary survey adjuncts. So we are going to divide this part into three categories or three videos. Like here we'll see, like in this part we'll see the basic acid-base disorder, how we have to diagnose, what are the normal values. In second and third part we'll see regarding the metabolic and then respiratory related disorders respectively. So first, like we told, in this part we are going to focus on the what the normal values, what is mean by ABG, all the things. So before getting into the interpretation, what is mean by ABG or what is mean by VBG? So both are same terminology only. What is mean by that? So ABG in the sense, ABG analysis in the sense, you know, that is a arterial blood gas analysis, right? Arterial blood gas analysis. If VBG also the same thing only. Instead of artery, we are going to take blood in the venous. So it is a venous blood gas analysis. What is mean by that means the name itself giving a clear explanation. So then we are going to analyze some gases which is present inside the arterial blood or venous blood. Okay, that is called ABG or VBG. So we are going to analyze some gases which is present in your arterial blood or venous blood. Okay, so by this, what are the common gases we have in our blood? That is first thing, oxygen and then carbon dioxide. So which is the most common gas which will be present in your normal healthy individuals. So some of the other gases like a carbon monoxide also there, but we are not going to focus on that area. Only most common gases, that is your oxygen and then carbon dioxide. So what I'm going to check in the oxygen, so something value called PaO2, partial pressure of oxygen, and then SO2, that is saturation of hemoglobin. So these are the things we are going to check in the oxygen related. So in other way you can tell that is a oxygenation status of the person we are going to check. Okay, then CO2 in the sense, what we are going to check, something called PCO2. So what is the CO2, what is indicating means CO2 is a marker for your ventilation. If the person is hyperventilator means there is something called increased PCO2 washout will be there. If the person have a problem in some other things, ventilatory related, ventilatory restriction is there means CO2 buildup will be there. So CO2 is a marker for your ventilation. Okay, so this is what to rule out the oxygenation status of the person or to rule out the ventilation related problems, we are doing the ABG. So that is the first indication. Okay, second indication, to rule out the or to know the acid base status of the person. Okay, acid base status. So you know some of the condition like metabolic acidosis, alkalosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. So to rule out the acid base disorder, we are going to do the ABG. So these are some basic indication for your ABG. Apart from this, some of the medicines they have a modalities, like here you can see something called abnormal hemoglobins, like a carboxy hemoglobin, and then you can see the fetal hemoglobin. So those are the some values also we will get. If you have in this your medicine, if you have a provision means that also we will get. And then something electrolyte values also we will get, and then metabolite value, most importantly glucose and then lactate level we will get, creatinine and then bilirubin level also we will get, and then something called anion gap, HCO3 level and all we will get in your ABG. So basically we will get in the PCO2, PO2 and then pH, HCO3, these are the values. So that is why we told oxygenation, ventilation and then your acid base disorders. Additionally, if your machine have a provision like this means, so it will I think it will vary from the machine to machine. It is based on the availability or the test available in the manufacturer related things. So in our institute we have these are the things like oximetry we will get, and then electrolyte values and then metabolite values, and then we will get the something called temperature related values also we will get. So this is what is mean by ABG and then why we are doing the ABG, indication for the ABG. And then moving on to the next part, that is more common doubt what we have in our mind is how we have to differentiate VBG from ABG. So this is the one other most common doubts, how you will differentiate. First, while taking a sample itself you can identify whether it is a VBG or ABG. How means the color of the sample, and then filling, so how the sample is filling inside the syringe. So color of the sample, you know, that is a dark red or dark brown color, that is indicating venous blood. Okay, then second thing, you are how the syringe is filling by the blood, like it is is a very laminar flow, means that you can understand it is venous blood. If the blood is urging to fill the syringe, means that is your arterial blood. So by filling of the syringe, and then second thing, color of the sample. Third important thing, most importantly, what you can see means that is your PCO2 and then PO2 level. So you know, in arterial blood there will be a high concentrated or high amount of oxygen. In your venous blood there is a high amount of PCO2 level, right? Carbon dioxide level. So this is the one, it is your VBG, second is your ABG. So here you can see the normally the PCO2 level in your venous blood, that is about 45 to 50 millimeters in mercury, but in your ABG it will be 35 to 45 millimeters mercury. So the difference will be there. PO2 is the most important factor, it will differentiate between the VBG and then ABG. In your ABG it will be like a more than 80% will be there. In VBG it is about 30 to 40 or less than 50 something will be there. So that is your VBG. So this is your third differentiation. Fourth is your pH value. Mostly it won't be that much difference. It will be difference between your 0.003 to 0.005. That much difference only will be there in the pH. Remaining all the parameters will be remain same. So this is the third differentiation. Fourth differentiation, what you can see means, if you have a paper, ABG paper or VBG paper with you, there you have to check the PaO2 level. Okay, that is your PO2 level you have to check. So you might aware about that oxygen dissociation curve, right? The oxygen dissociation curve. So in that, there you have one value called P60. Am I right? Partial pressure of 60. So at the time of P60, how your SpO2 will be means, SpO2 level of more than 90% will be there. So what you have to do, take the ABG paper, see the PaO2 level. Here you can see the PaO2 level. So here you can see the PaO2 level, that is 83.9. So while the time I am taking this ABG, I seen that SpO2, that is 99% I seen in the monitor. So this is the way you can see the PaO2. If it is more than 60%, that should be SpO2 should be more than 90%. Okay, this is the way you can correlate. If it is less than means, so based on that oxygen dissociation curve, the SpO2 should be there. If the value is not correlating means, you can identify that is VBG. So these are the four differentiating factors from VBG to ABG. Now we'll enter into the basic ABG acid base disorder interpretation. So interpret the ABG. Mostly before interpreting the ABG or VBG, three important steps you should know, or you should remember, or you should follow. First thing, you should you have to verify whether am I interpreting the correct person's ABG or right person you have to take. Second thing, you have to check the whether is there any supplemental oxygen or the person in any ventilatory support. Those are the things you have to check. If the supplementary oxygen support is there means, you have to check the how much amount of oxygen, how much flow liter is there. If the ventilatory supported means, you have to check the FiO2 level also. These are the two important things you have to remember. Third and last important thing is whether it is a VBG or ABG, by you will based on the specific condition. If the condition is like a respiratory related things, you have to rule out something. Oxygenation status means make sure you are taking ABG, there you will get accurate value. So these are the some common things you should remember before interpreting your VBG or ABG. Then so now we'll see the interpretation of acid base disorder or ABG. So if you want to interpret acid base disorder means, three important values always you should remember, that is pH, PCO2 and then HCO3. So what is the normal value of pH? It is about 7.35 to 7.45. And then so based on pH, how you will differentiate acidosis and then alkalosis means, if the value is going less than 7.35, we used to call that is acidosis. If it is going more than 7.45, that we used to call alkalosis. Or in other area, less than 7.35, that is acidemia. More than 7.45, that is alkalemia. Okay, acidemia and then alkalemia. So this is what your pH. Second important parameter is your PCO2, that is partial tension or partial pressure of carbon dioxide. So remember, PCO2 is a marker for your respiratory related things. So whenever you want to interpret the respiratory related condition, you have to see the PCO2 level. So PCO2 normal value, we know it is about 35 to 45 millimeters in mercury. When you will call acidosis and alkalosis based on PCO2 means, or else in other term, when you will call respiratory acidosis, respiratory alkalosis. Before that, you have to remember, to understand that concept, you have to remember the normal physiology. So what's happening in your body? So the normal physiology in the sense, we know the carbon dioxide will react with your go into your reaction with your water, and then finally it will form the carbonic acid H2CO3. Okay. So by this, what we are understanding, if there is an increased carbon dioxide in your body means, there will be an increased reaction with water. Finally, there will be increased production of carbonic acids. So in other terminology, what you can tell, there is an increased CO2 means there is a condition called acidosis. Am I clear to you? So if there is an increased carbon dioxide in your body means it will go and react with your water. There will be a formation of more amount of carbonic acids. So that is why. So we are calling, if the increased carbon dioxide means that is indicating increased acid formation. Increased acid formation means that will lead to the condition of acidosis. That's all. So increased carbon dioxide means there is a value of greater than 45 millimeters in mercury. That is indicating acidosis, or in other terminology you can tell as a respiratory acidosis. Okay, then coming into next part, just the opposite to that. So there is an less CO2 in your body because of hyperventilation. The person is expiring all the carbon dioxide from your body means, so it will react with your water, and then finally it will form less amount of carbonic acids. So the acid level is low, production is low, but in your body there will be an increased bicarbonate level. So it won't compete with your bicarbonate level. There is a excess bicarbonate level, less production of your acid level. So ultimately it leads to the respiratory alkalosis. When the value is less than 35 millimeters in mercury. Hope it is very easy. So you just remember the normal physiology. By that, if it is going more than 45, or else there is an increased carbon dioxide in your body means there is increased formation of carbonic acid. It leads to the respiratory acidosis. Just opposite to that, less carbon dioxide, less amount of carbonic acid leads to the respiratory alkalosis. Third important thing, that is your HCO3. Okay, HCO3 we know it is a bicarbonate, or it is one of the base substance. So normal value 22 to 28 milliequivalent per liter or millimoles per liter. So we know it is a base substance. So base substance in the sense that is indicating alkalosis related things. So whenever you are in your body there is an excess base means compared to your acid, excess base means that is indicating alkalosis. Okay, if you are considering this one, excess bicarbonate level means that is indicating metabolic alkalosis. So here you have to remember HCO3 is a marker for metabolic. Okay, PCO2 is a marker for respiratory. So this is metabolic alkalosis. So whenever your body acid, this is alkali. So remember, this is acid, this is alkali. So whenever in your body there is an increased bicarbonate deficit, or the body is losing more amount of bicarbonate through the kidney means that is the condition called your bicarbonate deficit. On the time what will happen? Acid level will higher than your alkali level. Okay, that is the condition called metabolic acidosis. Okay, in other words, so metabolic alkalosis means the value will be more than 28 milliequivalent per liter. Metabolic acidosis means the value will be less than 22 milliequivalent per liter. So this is what the normal respiratory acidosis, alkalosis, metabolic acidosis, alkalosis, how the values will be. Okay, now we'll move on to the next part, that is your how you have to before that, what is the compensatory mechanism will happen in your body. Like compensatory mechanism in the sense, so we know whenever the body in the stress, it will try to compensate the condition. So for example, if the body in metabolic acidosis, so metabolic acidosis means what is the main thing will happen in your ABG. So pH, here you will take PCO2 and then HCO3. Okay, so metabolic acidosis means the factor you have to see here is an HCO3, am I right? So acidosis, pH will be less. So whenever you are interpreting the ABG, first see the one part, whether it is acidosis or alkalosis. So acidosis, pH will be low. In metabolic acidosis, why it is developing? Because of the bicarbonate deficit. Okay, bicarbonate deficit in the sense the value will be less than 22 milliequivalent per liter. What will happen in your metabolic alkalosis? There is an increased HCO3 level, pH will be more than 7.45. So what will happen in your respiratory acidosis? So the pH will be less than 7.35. There is an increased PCO2 buildup, right? Respiratory alkalosis, what will happen? There is an increased means pH will be more than 7.45. PCO2 will be washed out. Okay, this is the way it will happen. So this is what we explained in the previous slide. Now we are moving on to the compensatory mechanism. So whenever your body in the metabolic acidosis, so metabolic acidosis we told there is a bicarbonate deficit, there is a bicarbonate level is low compared to your acid level. So what the body will do means the body will try to eliminate the carbon dioxide by doing the hyperventilation. So why it is doing like this? So already the person in a acidosis condition. So if still the body is keeping more amount of CO2 in the body means what will happen? Again that CO2 will react with your water. Finally it will form the more amount of carbonic acid. Still if it is forming carbonic acid means the acid load will increase in your body. It will furtherly worsen the condition. So to avoid that, what the body will do means it will eliminate the more amount of carbon dioxide by doing the hyperventilation. Through that your respiratory tract, it will eliminate the carbon dioxide. Clear? Then metabolic alkalosis, what will happen? There is an increased your base load, or there is an increased bicarbonate compared to your acid level. So what the body will do, it will try to keep your carbon dioxide inside the body, thereby it will form the carbonic acid and then it will regulate the condition. So what will happen in your respiratory acidosis? Normally respiratory acidosis in the sense there is an increased carbonic acid level because of the high PCO2 level, right? So here what the body will do means, because of the increased acid level, so the body will try to retain the more amount of bicarbonate level from your kidney. Okay, in your kidney it will send the order to the kidney, it will retain the more amount of bicarbonate, thereby the condition will equal, neutralize. So what will happen in your respiratory alkalosis? Respiratory alkalosis in the sense there is an increased wash out of carbon dioxide. So what the body will do means, already the person have an increased bicarbonate load. So the body will give a command to your kidney to eliminate the bicarbonate through your kidney. So this is the way will happen. So here you can see this is for metabolic, this is a PCO2 value is a compensatory mechanism. Your respiratory HCO3 is a compensatory mechanism. Here you can see, so the HCO3 metabolic acidosis, HCO3 also getting low, PCO2 also getting low. So the direction you can see, okay. So in metabolic alkalosis, increased bicarbonate load, because of that the PCO2 level also will increase. So you can see the both are indicating same direction, that is called compensatory mechanism, also called the same direction rule. Okay, you got the concept, same direction rule. So this is the way your body will try to equalize the condition. And then we'll move on to the last important, most important thing, that is how we have to interpret the ABG, basic acid base disorder. First, so whenever you are getting your ABG, see the pH value first. Okay, see the pH value. By seeing the pH value, we can fix our mind whether it is a acidemia or alkalemia. Clear? Second thing, what you can see means, to differentiate metabolic to your respiratory, you can see the PCO2 value. Okay, see the PCO2 value. By PCO2, you can fix whether it is a respiratory or metabolic. So how can I explain means, so if pH and then PCO2 is traveling in a both direction means, that is indicating metabolic related issues. So I will explain you. So and then pH and then PCO2 is traveling in a opposite direction means, that is indicating respiratory related issues. Okay, how we can explain means, so first take in the condition of respiratory acidosis. Okay, respiratory acidosis, what will happen to your pH and then PCO2? So pH, respiratory acidosis in the sense, so acidosis in the sense pH will be less. Am I right? So respiratory acidosis, when it will happen, there is an increased buildup of carbon dioxide. So here you can see the pH and then PCO2 is traveling opposite direction. So in this condition, what you will call respiratory acidosis. Example, take a respiratory alkalosis. Okay, see the pH first, what will happen to your pH? Alkalosis in the sense pH build up more than 7.45. what will happen in when the respiratory alkalosis will happen? There is an increased increased carbon dioxide elimination. Okay, that is the condition. So here also you can see both are in opposite direction. That is why whenever the pH and then PCO2 is traveling, both are in a opposite direction, that is indicating primary respiratory disorder. Both are in same direction means, that is indicating metabolic. We'll take one example from metabolic acidosis. So metabolic acidosis, what will happen to your pH? pH will be low because of acidosis. Metabolic acidosis means there is a bicarbonate. What will happen to your bicarbonate? There is a bicarbonate deficit, right? And then what will happen to your PCO2? Here we are going to see only the PCO2 value, right? So PCO2, what is the compensation will happen in your PCO2? So the PCO2 level also will reduce. Am I right? So here you can see the pH and then PCO2 both are traveling in the same direction. So that is indicating the metabolic related changes. So clear your mind, just see the pH. By seeing the pH, you can fix whether that is acidosis or alkalosis. Second value, you just see the PCO2. If both are same direction, metabolic. If both are opposite direction, that is respiratory. Then if it is metabolic, then you can one step, you can go forward and then you can confirm by seeing the HCO3 level. So this is what you have to interpret the ABG in a more simple way. Some others, they used to remember ROME, respiratory opposite, metabolic equal. So both all concepts are same only. Okay. Then most important, final important statement which I want to conclude in the sense, that is sometimes the person will be present with a single condition. Okay, if respiratory acidosis will be there, or respiratory alkalosis or metabolic acidosis or alkalosis. In some rather case, how it will be means, there is a mixed acidosis or mixed acid base disorder. Means there will be an, so we told 4 important condition, right? 4 basic disorders. In this, out of 4, maximum 3 can present in a single person. So never ever expect with one condition. So sometimes if you are rule outing the person have a respiratory acidosis, furtherly you have to work up like whether the person have a anything called mixed acidosis or alkalosis also we have to rule out. So that and all we are going to cover in upcoming presentation anyway. But I am telling what I want to convey you means, so don't fix your mind or by diagnosing one condition itself, don't you have to don't conclude with the one conditions. Furtherly you have to work up for the further if there person anything have like a mixed acid base disorder is there or not, you have to rule out. Okay, that's why we told max in this out of 4 maximum 3 condition can present in the body. I can tell one example to you. For example, you are approaching the case of DKA, diabetic ketoacidosis. So in diabetic ketoacidosis, what will happen? Diabetic ketoacidosis, based on acid-base disorder, the person will present with a metabolic acidosis. Am I right? So in metabolic acidosis, what is the compensatory mechanism will happen in your respiratory? So it will try to eliminate the carbon dioxide from your body. If the body is overreacting to the metabolic acidosis, means if the body is eliminating too much of carbon dioxide from the respiratory system, means that is the condition will arise respiratory alkalosis. Am I right? So your metabolic acidosis, actually the compensatory mechanism is the body will try to eliminate the carbon dioxide from the body. But if the body is eliminating too much amount of carbon dioxide from your body, means that is the condition called respiratory alkalosis. Now you can see two condition came. In the same case, if the person is having prolonged vomiting because of the DKA and then abdominal pain, prolonged vomiting is there means, so in vomiting, what is the problem will arise? During the time of vomiting, the person will lose or the person will vomit all the gastric acids. So acid is going out means ultimately the alkali level will increase in your body. So here the person will develop the metabolic alkalosis. Okay, so this is the way. Here you can see maximum 3 condition here it came. So why we told 3 only means, so here always your metabolic acidosis and then alkalosis will combine. So here in DK also we told metabolic, here you can see metabolic acidosis and then alkalosis will combine, but never ever your respiratory acidosis and then alkalosis will combine. Means whether CO2 buildup will be there or CO2 wash out will be there. So CO2 buildup means respiratory acidosis will be there or respiratory alkalosis will be there. They won't never ever combine. Okay, your metabolic acidosis will combine, alkalosis will combine, but respiratory and all they won't combine at all, whether CO2 buildup or CO2 wash out. So this is what the whole idea or basic idea regarding your basic metabolic and then mixed acid base disorder. So we'll see you in a part 2 with some other ABGs like metabolic related condition. So until that, do your best. Shalom.